In this segment, we're going to discuss about dental cavities. What are dental cavities? Dental cavities are essentially holes in your teeth that are caused by bacteria using sugar as a substrate to produce acid that breaks down the tooth surface. What are the risk factors? The risk factors are genetics. In some individuals, the surfaces are stronger. In some individuals, the surfaces are weaker. Dieting, the more frequent you snack or eat, the more likelihood you're going to have acidic spike. Aging, as we age, more of the root surfaces are being exposed. The root surfaces are 10 times weaker than the crown surfaces or the enamel of the tooth surface. Dry mouth. If you have more than 2 medications that you're taking, you're likely to experience dry mouth. The dry mouth itself, what happens is that the salivary flow decreases and slows down the washing action on the surfaces, as well as neutralizing the acidity in the diet. Of course, the sugar intake, if you take the more sugar you intake, obviously the greater the chance that you're going to get a cavity. How can you tell if you have cavities? One of the indicators is that the tooth is going to be hot and cold sensitive. The other one would be the tooth will be sensitive to biting down. Obvious one is the one that you can actually see it visually, that you may have a hole. The changes in the color of the tooth structure may go from normal looking tooth structure to more yellow or brown or even to darker color. Also, it could be rough on the tongue as well, or the cheek. So those would be some of the indicators. Now, however, keeping in mind that you do need a dentist to diagnose definitively for you. Also, the dentist may use an x-ray to actually help diagnose or become a bit more conclusive in terms of the diagnosis. How can we minimize the risk of getting cavities? We need to consider using 3 strategies. One is to clean the surfaces of the tooth. Second is to provide a proper environment for the tooth to survive in. Third is that we need to cover the surfaces that are exposed to the oral environment. Coming back to the first, what we need to consider is that we need to consider maybe using an electric brush instead of manual brush. Electric brush are much more efficient in terms of removing plaque. For that end, I will probably suggest that you may want to consider getting a Philips Sonic Care. Flossing is a must for you as well, because the flossing actually helps to remove the plaque in between the teeth that may be causing cavity as well. The second part of the equation really has to do with creating a proper alkaline environment, because most of the time cavity happens in acidic environment. So we need to control that acidic environment by you neutralizing it with some alkaline rinses or toothpaste to help to minimize the acidic environment. The third is that the exposed surfaces can be covered. For example, if you have a deep grooves of fissures on top of the surfaces of the tooth, you can use sealants to cover those fissures up. Or you could have, for example, if you have root surfaces that are exposed, you can use free gingival graft of some sort, where you can grow some gum on top of those exposed root surfaces so that you can avoid those surfaces being exposed to the oral environment. This concludes our presentation today. I want to thank everybody for watching this video, and I hope to see you soon in our next video. Thank you.